Optimizing CDSS usage for workflow efficiency. Clinical Decision Support Systems, CDSS, have the potential to significantly enhance healthcare delivery by improving clinical decision-making and workflow efficiency. However, to maximize their benefits, CDSS must be seamlessly integrated into clinical workflows, offer time-saving features, and avoid overburdening clinicians with excessive alerts and recommendations. Here's how healthcare organizations can optimize CDSS usage for workflow efficiency. 1. Integrating CDSS seamlessly into clinical workflows. System integration. One of the most critical aspects of optimizing CDSS is ensuring its integration with existing clinical information systems such as electronic health records, EHR, laboratory information systems, LIS, and picture archiving and communication systems, PACS. This ensures that CDSS operates smoothly without causing disruption or unnecessary duplication of work. Single sign-on, SSO. Implementing SSO can streamline the login process, allowing clinicians to access CDSS features directly from their EHR or other healthcare IT systems without needing to log into separate platforms. This reduces time spent navigating between systems. Real-time data flow. The CDSS must have access to real-time patient data, such as lab results, imaging reports, medication history, and clinical notes. This enables the system to generate timely and relevant recommendations, which can be acted upon immediately. Work list integration. By integrating CDSS with the clinician's daily work list, the system can automatically prioritize alerts and recommendations based on the tasks the clinician is performing. For example, if the clinician is reviewing lab results, the CDSS can provide relevant insights based on those results. Contextual alerts. CDSS should be able to generate alerts that are context-sensitive, providing clinicians with relevant information based on the patient's current condition, clinical history, and care plan. This ensures that the alerts are not perceived as irrelevant or disruptive. Time-saving features in CDSS, alerts, recommendations, and documentation assistance. Automated alerts and notifications. CDSS can generate alerts to inform clinicians of critical changes in a patient's condition, such as abnormal lab results, potential drug interactions, or the need for preventive care, e.g., vaccinations, screenings. These alerts help clinicians focus on high-priority cases without having to manually monitor every aspect of a patient's condition. Example: if a patient's potassium level becomes critically high, the CDSS can notify the clinician immediately, allowing for rapid intervention. Evidence-based recommendations. CDSS can provide evidence-based recommendations for diagnosis, treatment options, and medication choices. These recommendations can be tailored to the individual patient, helping clinicians make well-informed decisions quickly and efficiently. Example: for a diabetic patient with a recent history of hypertension, the CDSS might suggest a combination therapy based on the latest clinical guidelines, helping the clinician avoid the time-consuming process of reviewing multiple treatment options. Documentation assistance. One of the most time-consuming tasks for clinicians is the process of documenting patient encounters. CDSS can streamline documentation by automatically generating clinical notes, summarizing patient encounters, and suggesting diagnostic codes and treatment plans. This reduces the administrative burden and allows clinicians to focus more on patient care. Example: after a patient visit, the CDSS can automatically populate the EHR with a summary of the encounter, including key clinical findings, recommended treatments, and follow-up instructions. This can significantly reduce the time spent on manual documentation. Clinical pathways and order sets. CDSS can provide pre-configured clinical pathways or order sets based on a patient's condition. These pathways offer a structured approach to patient care, with predefined orders for tests, medications, and treatments, reducing decision-making time and ensuring adherence to clinical guidelines. Example: in a patient with community-acquired pneumonia, the CDSS can present an order set that includes antibiotics, chest X-ray, and oxygen support, ensuring the clinician follows evidence-based practices while saving time on making these decisions individually. 3. Best practices for avoiding alert fatigue and overuse of CDSS. While CDSS can significantly enhance clinical workflow, excessive alerts and overuse of recommendations can lead to alert fatigue, where clinicians become desensitized to notifications, potentially ignoring critical information. Here are strategies to avoid alert fatigue and optimize the effectiveness of CDSS. Prioritize alerts based on severity. Not all alerts are equally urgent. CDSS should differentiate between high-priority alerts, e.g., life-threatening medication interactions, critical lab values, and lower-priority notifications, e.g., routine preventive care reminders. Alerts should be classified by urgency, with only critical alerts taking precedence. Example: a red alert might indicate a potentially fatal drug interaction, while a yellow alert could suggest an upcoming immunization, allowing the clinician to focus on more urgent issues without being overwhelmed by less critical notifications. Customize alert settings. Allowing clinicians to customize alert thresholds can reduce unnecessary notifications. For example, some clinicians may prefer to receive alerts for certain conditions or medications, while others may opt out of less relevant notifications. This flexibility ensures that alerts are tailored to each clinician's needs and responsibilities. Example: a pediatrician may choose to disable adult medication-related alerts, but enable all alerts related to pediatric dosing and immunizations. Use alert clusters. Rather than sending multiple alerts for similar issues, CDSS can cluster related alerts into a single notification. This reduces the total number of alerts and presents the clinician with a clear, consolidated view of the patient's condition. Example: if a patient has multiple abnormal lab results, the system can group them into one alert rather than sending individual notifications for each result. Implement continuous feedback mechanisms. Regularly assess the relevance and effectiveness of alerts. Clinicians should have a mechanism to provide feedback on alerts, such as whether they were actionable or if the alert was redundant. This feedback helps in refining the system to reduce unnecessary or irrelevant notifications. Example: if clinicians consistently dismiss a certain type of alert, the system can be adjusted to either remove the alert or modify it to provide more actionable guidance. Limit non-essential recommendations. Overuse of recommendations, especially those that are not immediately relevant to the patient's care, can overwhelm clinicians. CDSS should focus on delivering recommendations that are timely, relevant, and evidence-based, avoiding recommendations that are not crucial to the current clinical context. Example: if a clinician is reviewing a patient with diabetes, the CDSS should prioritize recommendations related to glucose management or cardiovascular risk reduction rather than irrelevant information about unrelated conditions. Educate clinicians on efficient use of CDSS. Clinicians should be trained to understand how to use CDSS effectively, including how to manage alerts, interpret recommendations, and customize their settings. This education ensures that CDSS is seen as a helpful tool rather than a source of additional burden. Example: training sessions could focus on how to configure alert preferences, prioritize high-urgency alerts, and efficiently utilize the recommendations provided by CDSS.